I'm so excited to bring you this week's podcast. I'm going to be joined by one of the country's most highly regarded, possibly the highest regarded plastic surgeon. And no, this is not a solo episode. I'm not talking about myself. And this plastic surgeon and I, we're going to discuss some of the hottest treatments in plastic surgery today. We're going to be talking about the Deep Plane Facelift and what it is and whether that may be beneficial for patients. We're going to be talking about preservation rhinoplasty, the preservation breast augmentation, the new breast implants. We'll also be talking about regenerative treatments like platelet-derived growth factor, PRP, PRF, exosomes, stem cells, and a whole lot more. Okay, so let me introduce my guest this week. We're going to be talking all about the hottest trends and treatments in plastic surgery. I mentioned earlier, we'll be talking about the Deep Plane Facelift, which is a really hot topic, especially with Kris Jenner and her recent facelift. We'll be talking about rhinoplasty surgery, breast implants. We'll be talking about fillers, regenerative treatments, and a whole lot more. I'll be joined by Dr. Rohrich. Dr. Rohrich is an internationally recognized board-certified plastic surgeon in Dallas, Texas. He is a clinical professor of plastic surgery at the Baylor College of Medicine. He is board certified by the American Board of Plastic Surgery, and he has led most of the key professional organizations in plastic surgery in the United States. He served as president of the American Society of Plastic Surgeons. He is president and founding member of the Rhinoplasty Society, president of the Dallas Society of Plastic Surgeons, and president of the Texas Society of Plastic Surgeons. He's received numerous honors and awards in plastic surgery and cosmetic surgery, both nationally and internationally. And honestly, Dr. Rohrich has so many awards, so many publications and service titles that it would seriously take me this entire podcast to list them all out to you. But suffice it to say, Dr. Rohrich is possibly the most highly regarded and one of the most famous plastic surgeons in the world. And it's a real honor to have him on my podcast this week, where we talk about all the latest in cosmetic plastic surgery. Let's get started. Well, thank you so much for joining me.
It's my pleasure.
So I'd like to start the interview by asking you about the current state of your practice. So you're a practicing plastic surgeon in Dallas, Texas. You've been practicing for 40 years, approximately 40 years. What does your practice look like today?
Well, today it looks like I'm primarily doing cosmetic facial surgery, primarily rhinoplasty and facelifts. And, I have two fellows, we have residents. So I teach every day, operate 5 days a week. I travel globally, lecture and operate around the world, and do what I love what I do, and just like you, I only operate on people I like. And
so you are the only surgeon in your practice, correct?
Well, actually, there's 12 in my group.
There are.
The Dallas Plastic Surgery Institute. Yeah, I'm one of the founding members, and there's 12, and we just added one this last year. So, yeah, plastic surgeons, as you know, Tony, are like herding cats. So there's 12 of us together. But we're all independent practice. We're all independent PAs, so actually it works because we just share common overhead, common staff, common business people. But we all have independent practices. But it's fun.
And do you have nurse injectors, PAs in your practice?
Yes, I have a nurse injectors, and I also have a research unit. So I'm currently doing like 4 FDA trials and 3 instrument and device panel studies. So I'm doing that as well. I do that, as part of my practice, and I inject as well, Tony. I inject every day in my patients, and that's fun. I love it because it keeps me from being bored.
How many estheticians does your practice then employ?
Well, we have I have one nurse practitioner, and then in our group we actually have a spa that has like 4 estheticians and 3 injectors. But in my own area, I have one nurse practitioner, and then I have a whole research group too that basically does the research clinical trials.
And how has the practice of plastic surgery changed over the years for you? I'm assuming that this was not the practice that was set up when you started your practice many years ago.
Of course not, Tony. I came from Boston. I came from Mass General, and I was the first full-time person at the University of Texas at UT Southwestern at Parkland, and was hired by Dr. Barton. And so I went from doing that to, I ran the department for almost 25 years and went from one faculty to 30, like 300 staff. So, and then I transitioned to my private group here about 12, 15 years ago. And, it's been fun. I mean, my practice has completely changed. I mean, I'm a hand and micro and craniofacial surgeon. I did that. I did breast and micro, and then I did Mohs, and then I transitioned to rhinoplasty and facelifts. So I've had like 3 practices, Tony. I'm sure much like you have.
Well, one of the things that I admire about you is that in addition to being really one of the most published plastic surgeons in the country, you're also very up to date with plastic surgery trends, specifically even social media trends that are going on today. So on today's interview, one of the things we're going to talk about, really one of the main focuses of the interview today, is going to be trends that we're seeing on social media that you're seeing in your patients. And we're going to really go from top down. But the first thing I want to ask you about is something that is a super hot topic in plastic surgery. And you were recently voted the #1 plastic surgeon in the country by Newsweek magazine for facelift surgery. And you've got, we all know, if you've been following social media, the biggest trend right now in facelift surgery is the deep plane facelift. So can you explain to my audience what the deep plane facelift is, what your thoughts are about it, and how that may differ from the facelifts that are otherwise being performed today that aren't quote unquote deep plane?
Okay. Great question. Hot topic. It is the deep plane is definitely a hot topic in social media. But number one, the deep plane is not new. In fact, it was really described here in Dallas by the late Dr. Sam Hammer, who just passed recently in the late 80s. And really all it is, there is multiple layers to the face. And the deep plane is really a misnomer because it's not going deeper, it's extending more medial. In other words, when every facelift goes from the mobile to the immobile mass, and what the deep plane does is you're mobilizing more of that deeper layer more medially, and theoretically that allows you to lift the tissue better. Now, again, that's not a new topic. Dr. Hammer described it, but it's been rejuvenated in the last really 10 years and really with fervor the last 5 years. And is it better? Is it last longer? I just published an article that's in the journal this week called Demystifying the Deep Plane. So the answer to both of those questions is that there's no data to show that it is better or lasts longer. There's a hint that there's more problems, especially with facial nerve injury potential, and the learning curve is higher. So, like a lot of things in social media, Tony, there's a lot of, fads and trends that don't always wash out. Now, it's very hot. Every patient of mine, just like yours, when they come to see me for a facelift, are you doing a deep plane facelift? I'm saying, yes, of course we're doing a deep layer facelift. We've been doing it for a long time. So I think the short answer is, it's still out, for looking at it from a science-based fashion. There's no good data to support that it's better or lasts longer, but there is morbidity. I must say, I see so many more patients now that have had problems with the deep plane facelift from even the quote unquote famous people. And so you got to know before you go. So if you're going to do that, you got to go train with people, do the cadaver dissections, and do all the right things because facial nerve injuries are not very forgiving. And so that's my only thing is that, don't do crazy stuff. And if you get good results doing the things you're doing now with a facelift, I find it hard to change. And, I do a lot more extensive. I do mastectomies, high SMAS, all those things. But, the deep plane, especially the release of the excess ligaments medially, does not make a lot of anatomic sense to me long term.
So for our listeners today who are wondering, okay, he's kind of explaining the anatomy of this. Essentially, the way that I describe the deep plane facelift versus a more traditional SMAS facelift, different types of SMAS. Essentially, they both create incisions in similar locations in front of and behind the ears. In a more traditional SMAS facelift, like what Dr. Rohrich is talking about, we elevate the skin separately from elevating the muscle layer and then resculpting some of the fat. In a deep plane facelift, the skin is elevated, but probably about midway down, once you elevate it to about halfway down the cheek, then you actually make an incision through the muscle layer and then dissect in that quote unquote deep plane underneath that muscle. And the idea is that you pull the skin, the muscle, and the fat kind of all up as one piece. But the problem with that, and the concern, as Dr. Rohrich has explained, is that when you do dissect into that deep plane underneath that muscle, that's where the facial nerve fibers reside. Those are the nerves that supply the muscles of your face. And as he said, there's a concern about, injury to those nerve fibers that can cause potential issues with facial paralysis.
Right. And the controversy is do you really need to elevate that far medially? And also, do you need to release those ligaments? Because sometimes releasing the ligaments can cause facial distortion. And I've seen that in deep plane facelifts. Because what happens when you're doing a deep plane facelift and you're elevating it all in one vector, it can look operated on and look overdone. And I think that's the amazing thing. But one of the most interesting things recently on social media is that all of the famous people that quote unquote look dramatic, look amazing, like for instance, Kris Jenner, guess what? She had a mastectomy or mass stacking with or without fat grafting, and Brad Pitt and all these other people. And we definitely know for sure Kris Jenner did not have a deep plane. So it's kind of a humbling thing for the deep plane people to say, oh, but she looks amazing. So the bottom line is good surgeons get great results no matter what technique they use, but basically they do it on an individual based on facial aging. And the one thing that I think that almost everybody agrees on is that you should do central facial fat grafting, because no matter how deep and how hard you pull, you can't fix this central part of the face without fat grafting, because as we age, we lose fat in our face. So there's a lot of things that go into the deep plane. But, it's again one of those social media things, Tony, we all get asked about the deep plane. And, patients don't have a clue about what the deep plane is until you tell them about it. And they say, oh, that makes a lot of sense.
How much do you think the popularity of the deep plane facelift is due to the charges that plastic surgeons charge for it? There are reports now, and there was an article in the Wall Street Journal recently talking about how some plastic surgeons are charging $150,000, $200,000 for the facelift. It used to be that there were a certain handful of plastic surgeons around the country that could charge really huge amounts, not even that much, but still huge amounts, because they're famous. They've spent 30 years developing a massive reputation. Now it seems like any, middle of the road plastic surgeon says, hey, I'm doing a deep plane facelift, and by the way, it's going to cost you $60,000. How much do you think of plastic surgeons now doing more of the deep plane facelift has to do with really the draw of, well, if I do it, maybe I can charge more for it and basically make more money?
I think that's a huge deal now, because if they say they do the deep plane, I think two things happened. COVID happened, and Dr. Ciccone, who's a well-known facial plastic surgeon, really kind of helped popularize it. And he started charging a lot more in New York, and charging more and getting a good or bad result, that they don't necessarily correlate. But yeah, I see that all the time. I've seen it in Dallas. I've seen it in every city in the country. But I think that's somewhat problematic to me, because you should charge what I think is an acceptable fee on the part of the country you're living in. And if you want to go out of bounds on that, I just have a problem with that. As a plastic surgeon, we obviously are highly trained and highly experienced, but I don't think you should, go crazy and charge exorbitant fees to patients. I don't think that's a good idea.
Well, I agree with you. Sticking with the face, let's shift gears and talk a bit about injectables. Most of the people who are listening to this podcast, they know about Botox, they know about hyaluronic acid fillers, but more and more people have been talking about a category of facial injection fillers, essentially. They're called biostimulators. Can you explain what a biostimulator is and how that is different from hyaluronic acid fillers like Restylane or Juvederm?
Yeah, the fillers are, and really they're not really fillers, they're hyaluronic acid. The ones in the US, except for one, are all hyaluronic acid based fillers. They're potentially biodegradable, which we can talk into, which sometimes they're not. Then the biostimulatory group is a group, and there's really like two main ones in the US that are available, are ones that stimulate collagen formation. Either one is by inflammation, which is Sculptra, and then the radius is truly by collagenesis. And that sounds very good, because basically you're injecting something that actually can cause your own body to promote collagen eventually, which sounds like a good idea. And I think both of them are very good. Sculptra is very good. Radius is very good. I mean, Radius gives you more immediate results. Sculptra is a more staged result because basically it's really like Vicryl, as we all know it as surgeons.
While I know how important it is to eat healthy meals, my wife and I are both busy doctors who not only work, but also take care of our kids and our 2 rescue dogs. So when things get busy and we don't have the time to make a meal from scratch, we reach for Tempo. Tempo gives you balanced, fresh meals that are actually good for you, they taste great, and they're ready in minutes. No skipping meals, no sad takeout, no endless prep. Each meal is perfectly portioned for lunch or dinner and ready in just 2 minutes. And with 20 new recipes every week made from nutrient-rich ingredients, Tempo keeps things exciting and helps you stay consistent with healthy habits. Last night, my wife and I ate the spicy Korean barbecue chicken meal, complete with steamed edamame, carrots, bok choy, and jasmine rice. It tasted great and was ready in less than 5 minutes. So no matter your goals, there's a Tempo meal for you. Protein-packed meals with up to 30 grams of protein, calorie-conscious, carb-conscious, and even fiber-rich. For a limited time, Tempo is offering my listeners 60% off your first box. Go to tempomeals.com/Dr. Youn. That's tempomeals.com/DRYUN for 60% off your first box. tempomeals.com/DRYUN. Rules and restrictions may apply.
And I think they're both very good if injected in the right plane by the people that are technically experienced. Because as a plastic surgeon, just like you, Tony, I worry about it because, when I do a facelift today, it's rare for me to see a virgin facelift that hasn't had energy devices, fillers, biostim. It's like, and also many times they don't even know, Tony, right? They say, oh yeah, I had it. They tell me after surgery. I say, oh yeah, did you have that? I say, oh yeah, I did have a little bit of Sculptra about 2 years ago. It's the plane it's injected. If you inject Sculptra and Radius in the right plane, I don't think there's a big problem with doing a facelift, but oftentimes it's not. It's injected into the quote unquote SMAS or deep plane, and then it can be a real challenge. And so it's not the biostimulator that's a problem, it's the injector.
Interesting. And there are certain new treatments, and it's kind of the idea of regenerative newer treatments out there that are being done not only by plastic surgeons, but by kind of holistic medicine experts and things like that. So I'd love to kind of get your opinion on certain ones of these. The first group really is going to be PRP, which is something we all know about, platelet-rich plasma. You basically draw your blood, you take out the platelets, but people are also now talking about, in addition to platelet-rich plasma, platelet-rich fibrin. Can you explain the difference between PRP and PRF and what your thoughts are with these as cosmetic treatments?
Well, basically, for the viewer, PRF is like PRP on steroids. Basically, it's more enriched. It's supposed to be better, last longer, have less treatments. I think both are fine. I think, we use both PRP, PRF, and they're fine and they're safe. They use the patient's own blood. It's okay to do that. And there's some offshoots of that as well. So I think many times they're microneedled into place, when you do microneedling, especially in the tear trough area, because in the tear trough, we've kind of gone away from fillers. So anything you can do but fillers in that area. I mean, microneedling with PRP is good, and PRF is probably better, especially if they have, deeper rhytids or pigmentation issues. So I think this era of bio-regenerative medicine techniques and technology is, I think, the new horizon, Tony. I think we're going to be going away from fillers and even the biostimulators, but to going to, really bio-regenerative type of group of medications and fillers that actually I think will make a lot more sense. And then of course, on the horizon now is probably the most controversial of all, and that's PDGF.
Mm-hmm. Yes, I was going to ask you about that. Let's talk about that. So that's made a bit of news lately on social media. Our good friend Dr. Christian Subio has gotten some people pretty hot and bothered with it, and he's been pretty upset as well. Can you explain what PDGF is and the controversy that's going on with it right now?
Well, platelet-derived growth factor is one of the most powerful growth factors in the human body, but a bioengineered growth factor, which is what Essence is, it's the first bioengineered growth factor, and it is FDA approved in 4 different areas, from dental to wound care to orthopedic surgery, all of those areas. And so it's a very, very highly studied, FDA approved protocol for these types of things, used in over 5 million patients around the world. So it's a really safe, and I think it's brilliant. Now, the transition into aesthetic medicine is always the new jungle and frontier, and it's called Essence. And basically, what the company's done is, in a nondescript manner, kind of put it out there because it's platelet-derived growth factor. So how to use it? I mean, and they put on there that it's not intended for intravenous use, but topical. So of course it's been used a lot, in microneedling, in the hair, in the face, which is it's like over 1,000 times more potent than PRP than PRF, Tony. It's amazing, and I've actually used it now for almost 2 years, and I've used it in well over 100 facelifts. Where I used to use PRP, I sprayed it in before I did my facial flap closure for bruising and swelling. Now I use PDGF, but the key with PDGF, and these are off-label uses, but the key is you have to really blend it. Now that's a fancy name for diluting it. So I diluted 20-1 because it's so powerful, so concentrated. So I diluted 20-1, so it's almost like PRP and PRF without having to harvest a bunch of blood and centrifuge it like you talked about earlier. And I'll spray it into each side and close it. It's amazing. The results, and we're going to be publishing it. The bruising and swelling, and of course it's somewhat objective, is absolutely amazing. But it's a growth factor, and there are so many more that are going to come, Tony. This is the tip of the iceberg on growth factors, and the company and the science is very solid, and they've spent millions. And you don't get 4 FDA approvals by just by the way, it may or may not work. But I think that the tipping point here has been for the controversy that Subia has talked about, which is, I think, not inappropriate, is that some people say, oh yeah, I'm just going to run and do it for IV use or injection stuff. But remember, the FDA really makes sure it's safe. They're not doctors. They don't tell us how to use it. Just like with breast implants. So the individual practitioners, there's a lot of them, and you can see it on social media. And I know many of them have used it for other things. And certainly what I'm using it for in the facelift is off-label, but it's somewhat topical. But its use in other areas like injectable in hair, the results, from some of my friends that are using it, has been dramatic. Because, instead of injecting PRP, which has been used a long time in the hair, they're using PDGF. And then also for tear troughs, it's been transformational in some of these patients. So that's off-label use. Now, is that quote unquote legal? I mean, I'll let the company and everybody else decide. But I think the most important thing is that we need to look at the science, and the company I know is doing studies now to show that all of these things are fine to do. But it's a work in progress. And I think the bottom line is, if people are concerned, you should not use it anything but for topical use right now. And I think that's what Subia
two other types of products that are in a similar situation where the FDA has cleared them for topical use, but not necessarily for injection, would be salmon DNA, so PDRN, as well as exosomes. And so have you had any experience with either exosomes or PDRN as injections, not topicals, because people are using those topically as well, oftentimes microneedling it and then applying it?
Yeah, no, I haven't yet. I don't have any, experience with PDRN and, salmon. I really think that is I mean, that to me is a little bit of the Wild West because that has no FDA indications, very little science, a lot of holistic stuff out there, but very little science. I mean, but I know Kim Kardashian did it, Tony, and I know you
Well, she does it,
and
then hey, it's good
I
for
know
all
she
of us,
did. I
right?
know, she went to Korea and she could have had it done anywhere, right? I guess. I mean, in the U.S., but that has, in contrast to PDGF, that has hardly any science, and to my knowledge, has no FDA approval for anything. So, but
I think it's
people are using it, and
considered
of
more,
course,
yeah, like as a cosmetic.
right. But I mean, to me, that should be the rage of saying, "Hey, are you crazy doing that stuff?" I mean, that should be. I mean, I think we should get Subio on that. But why'd you do that, Silvio? Get on salmon, injecting people with salmon. I've never done that, and I think you know I don't know. I have no experience. Have you had experience with using salmon? I haven't done it.
No, and I think it's, in Korea it's super popular. I know a lot of people who've gone out there and have had it done. It's very painful, is my understanding. It is the idea is it's a biostimulator, and so the idea is stimulate collagen production. But I have not seen any true studies on it being injected. I have seen some stuff on people who've had it, more as a topical, like after microneedling and all that. And it does appear to be very safe. I mean, I think it's promising, but just like you said, not a lot of science there yet. But a lot of people that I've talked to who've had it done and who have gone to specifically to Korea, have had it done, have really seen nice changes in their skin. So, but it's been all, mainly anecdotal.
Yeah, same here. And I've had similar experience with some of my patients that have gone to Korea. Korea is really, I think Korea is the cutting edge for skincare and all amazing stuff.
What are your thoughts now with stem cells and exosomes? And what's your feeling as far as where that's going to be going, hopefully in cosmetics in the future?
Well, stem cells, I mean, exosomes are kind of the messenger to tell the body what to do or the stem cells what to do. So stem cell technology, I think, has an evolving science. And I think some of the most impressive evolving science is that's completely derived from the one that's patented at the Mayo Clinic. And I'm just, it happens to be plated or something, but that's an evolving science now. And topically, it's been used, and we've done some of their studies, both hair and others, and it seems to improve it to actually a statistically insignificant amount. And that's just topical application. Now, to my understanding, they are moving forward with an IDE and doing it for other uses, intravenous and other uses, which I think is the right way to do it. And I think they're proceeding to do that. So I think exosomes are a very exciting new area that actually may have a pathway to approval. But I can tell you, the FDA is so resistant. When you mention, and especially stem cells, they just retract it because there's so few stem cell studies that have been approved by the FDA. Now, you and I both have patients that go abroad. They go to Mexico. They go to Europe. They go to Russia. They go to the Eastern Bloc countries, and they get it done. And some of my patients swear by it. I just don't know. I mean, the science theoretically makes sense, but I'd sure love to see the science being done in the United States.
All right, well, let's shift gears. I mentioned earlier that you were voted the #1 plastic surgeon in the country by Newsweek magazine for facelift surgery, which is, a huge honor. There's thousands of us, yet Dr. Rohrich was voted #1. And I think more than once you were voted #1 for that.
Yeah,
but the other one that you were voted #1 for is rhinoplasty surgery, or nose reshaping surgery. And there has been a trend in plastic surgery where plastic surgeons are using the term preservation as in some ways a marketing term, but it's also a different way to do rhinoplasty surgery. So can you explain to my audience what the difference between a traditional rhinoplasty is versus a preservation rhinoplasty, and why a patient may want to lean towards one or the other?
Right. Well, there is structural rhinoplasty versus preservation rhinoplasty. Structural rhinoplasty is a rhinoplasty that actually was been done for a long time. Comes from the era of Joseph, one of the fathers of rhinoplasty, and that's where you basically take the nose apart, especially the dorsum. You separate the tissue and the cartilages, and then you take the bump down, and then you reshape it. A little more challenging to do. Preservation rhinoplasty is when you have the dorsum, but you actually preserve this part of your nose, but do the underneath kind of like opening the hood of your car and then fixing everything underneath it and then pushing it down and making it look normal. Now, that sounds really good because that way you're keeping the integrity, preserving the integrity of the dorsum.
The holidays are here, which means parties, family gatherings, and plenty of reasons to look and feel your best. But are you, like me, concerned with your thinning hair? Well, if so, then I recommend the iRestore Elite. The iRestore Elite is the premier hair growth helmet on the market. It's clinically proven to help regrow hair using 300 lasers and 200 LEDs that send light therapy directly to your scalp. Well, the iRestore Elite is an easy at-home system that's designed to fit your lifestyle. You can pop it on while watching holiday movies, wrapping gifts, or even while you relax with a good book. It's lightweight, hands-free, and so simple to use. And best of all, it really works to thicken your hair. And if you want to boost your results even more, pair the Elite with the Revive Plus Max Growth Kit and the Revive Biotin Vitamin Gummies for the ultimate hair care bundle. Whether you're treating yourself this season or gifting the confidence of great hair to somebody special, the iRestore Elite is the kind of present that makes every day feel like a good hair day. Holidays mean get-togethers, photos, and wanting to look and feel your best. iRestore is here to help with huge Black Friday savings happening all month long. And with the code Dr. Youn at iRestore.com, you can unlock an exclusive discount on the iRestore Elite. That's Dr. Youn, DRYOUN, at iRestore.com. Please support our show and tell them that I sent you.
Now, again, Tony, this is nothing new. This has been if you look at the facial plastic literature, it's been there for over 50 years. So going back to Dr. Cottle and others, and in the race between Dr. Cottle and the Joseph Rhinoplasty people, the Joseph Rhinoplasty construction ones won, decades ago. And now there's just been a rebirth of this old technique, which used to be called push down, let down. Now, that's not a very attractive term because, you didn't know if it was the surgeon that pushed it down or the patient that was let down. I don't know. But now, a few years ago, a surgeon said, hey, let's call it preservation rhinoplasty, which I think is a little bit of a misnomer because honestly, Tony, to do a preservation rhinoplasty, you have to be very experienced as a rhinoplasty surgeon to do that because you are operating on the septum. And if you mismanage the septum, you can cause catastrophic events, saddle nose deformities, all kinds of issues. And I've seen those. Again, from experts, because I, get referred to those patients. So it's not, first of all, rhinoplasty, whenever somebody says what the doctor said it was a simple operation, it's the hardest thing we do. And I've done thousands, Tony, and I never tell anybody it's a simple operation. It's a hard operation because all you have to do is see your follow-up patients that are 3-4 years out and you say, that could have been better. Mm-hmm. So basically, is there a role for it? Absolutely. It's a great operation to do. I think it's a technical finesse procedure. And what I've seen in the last, it's been out for, I don't know, in the US, popularized for about 5 to 7 years. And at every meeting I go to, and I travel around the world, I always ask how many people are doing preservation rhinoplasty. And it's always the same 5 or 6 people out of, 500-600 people that raise their hand. So it's not really caught on. I know a lot of people have talked about it, but it's not caught. I do it. I've probably done, 150 patients. I just published an article in the journal that's going to be out. It talks about the 5 indications to do it when you're starting it. And that means, if they have good dorsal aesthetic lines, they have a good septum, it's not too S-shaped or too crooked. There's several other techniques or indications, but, I think you have to become a master of structural rhinoplasty first. So in summary, it's a good technique. It's not for everybody. It's a little bit of a marketing tool. The word preservation is now used in everything. There's a preservation facelift. There's a preservation breast surgery. It reminds me of when, whenever you put ultrasound before something, it was always a good thing, right? Or laser.
Yeah, laser, yeah.
laser blepharoplasty.
As I was going over this, I was thinking the other day how, it was probably about 20 years ago where all of a sudden everything had to be clear. So you had Pepsi clear, Coke clear, and even like gasoline was clear. Like for some reason, there was this fad where, do you remember that? Where everything was clear. I don't know why, but... And so now I'm as a plastic surgeon, like everything now all of a sudden is preservation. It's just like, why? Like, what does this mean?
I know. It went from preservation rhinoplasty now to preservation facelift, which means basically the preservation facelift is that you don't undermine like the 2 layers like Tony was talking about. You just have one layer and then you're preserving it.
Okay, let's switch gears and talk about preservation breast implants or preservation breast augmentation. What are your thoughts on that? This is something that is definitely new. People are starting to talk about it. You see it on social media. Can you explain your thoughts on this?
Well, I loved your, and by the way, obviously, Dr. Youn is a phenomenal plastic surgeon. Not only is he a YouTube star, but I loved the one you did on the preservation breast augmentation in Motiva, which is a nice new company. It's a great new company coming out. And basically, um, it's kind of like Back to the Future. Are we really going to go and make a small incision and blindly dissect out a small pocket above the muscle and then blow it up and then put in an implant? I mean, that's how we were taught in the 80s, Tony. And when I was at the University of Michigan, we did, the blind transaxillary approach. We did it below the muscle, but I don't know. And is that really preservation breast augmentation? I'm not so sure about that. I think there needs to be more studies done. I'm not so sure. When you have techniques and technology that work really well, especially things that are going to be in the body for a long time, you got to be careful about what you're saying and doing. So, and you and I were both in the breast implant crisis, so I'm not so keen on, doing crazy new things with foreign bodies that are going to be in the body a long time.
Yeah, I think, so people are explaining that, just like you said. I mean, it actually reminds me of transumbilical breast augmentation, where you make an incision and you tunnel and create a space using balloons, essentially, to and then put the implant in. Obviously, that's something that I'm actually going to be heading out to Costa Rica to learn this in January.
Oh, good.
So I don't have any opinion on it now, since I haven't done it. I haven't seen any of the presentations, although I have seen some plastic surgeons that I respect on social media who are big fans of it. And the idea that they basically explain is that you have to use a very small implant. You put the implant above the muscle, and using a balloon, you basically kind of tear open a pocket there, but leaving certain ligaments on the sides and all of that intact, so that the idea is quote unquote preservation. But as your concern, I think, is the same as mine, with potential issues with capsular contracture, with bleeding, with long-term outcomes, with droopiness of the breast and control. I've seen that with people who've had implants placed through the belly button, where the placement is a major issue, and the only way to fix it is to give them the scar underneath the breast to actually go in and surgically fix everything up. So I don't have an opinion on it yet, just because I think I want to really see it up close and personal before I make a definite decision on it. But I'm like you, I'm not the first surgeon to jump onto the newest technique because I hate complications.
Right. Yeah, I agree, and I you said it so well. I mean, I've not been to Costa Rica, and I think the company has some good science. They've got some good studies, and I think, but it's evolving, and and I've not done it, so I don't want to be, talking that, I usually don't, I don't want to be like the Pope talking about marital counseling if, we haven't. So I would say, I think it's good to try it and see how it works, and but there's a lot of other good techniques and technology out there that's been proven to work well. And, I think we just need to listen also what's happening worldwide with implants. And, I think implants overall, by the way, they're the most studied foreign body placed in the human body for almost 60 years. They're overall reasonably safe. They do break down. They're man-made, not God-made. And now it's maybe 15, 20 years, but so we have good science on it, and it's just a different twist. And the other thing is it a textured or a micro texture? That's the whole other, controversy. This is a micro textured, so it's really been labeled by the FDA as a smooth type implant. Mm-hmm. So I don't know. I think time will tell. I'm like you, Tony. I think it's good what you're doing. You're going to go and see it, and I'm sure they're going to just dazzle you out there. And like you, a lot of my good friends that do breast surgery have climbed on board.
Well, speaking of breast surgery, one of the things that you and I have in common is we're both very much into holistic treatments. You are a big fan of yoga, as am I. One question that I have gotten quite a bit in the recent past is it okay if you have implants to go into the sauna? Because there has been a belief that's been spread around certain holistic circles that your implants can melt if you go into the sauna. Now, I will tell you, I am a male. I don't have implants. I have a sauna that I love. My sauna that I have a red light and infrared sauna. But what are your thoughts on implants and saunaing? Is that okay, or are they going to melt inside of you?
100% that they're 100% safe. The science behind implants melting is like tenfold that or 100-fold that of a sauna. So honestly, that's just fear mongering on social media. I just that makes no sense scientifically or otherwise. I mean, saunas are safe, red lights are safe. Those are all good. In fact, saunas probably has the best science on that for longevity, more than the cold plunge, without the cardiac problem. So, I mean, the Scandinavian data on saunas, especially 20, is phenomenal. I'm thinking about doing that too. You have one in your home?
Yeah, so I have a sunlight and sauna. Yeah, so it combines, it's infrared. So it gets, when it gets hot, we're up at about 140 degrees. I don't get it a whole lot hotter than that, although traditional steam saunas, you can get like 180.
Does it? I thought 120 was okay. It was where you started getting benefits. Is that not true? Was it?
You probably want to get up to about 120 at least,
Yeah.
because I mean,
Oh,
when you're heating it up, you can, it starts off real low. The thing with the one thing I really like about my Sunlighten is the fact that it's infrared, so you're getting that benefit without going quite so hot,
yeah.
and that they have tablets. I have a tablet in my sauna, so I just sit there and I watch Netflix or I watch HBO Max. I sit in the
Oh,
sauna. It's
fantastic.
actually quite nice.
I'm going to talk to my wife about it. Maybe I can talk her into it. I think that's a great idea. And what Tony's talking about, both the red light and the sauna, especially the sauna, has amazing science behind it.
Yeah,
But
my
I
wife
think
loves
the
it.
implant thing is fear mongering. What do you think? I think,
So, the argument that was made was that implants aren't made to go 180, 200 degrees in temperature. But the fact is that your body doesn't go 180 degrees in temperature. Boiling water is
you'd be
200
dead.
degrees.
Yeah,
If you're at 106 degrees, you're probably dead. And so your body, even though the outside air is going to be, potentially as hot as 180, your body core temperature is not going to be anywhere near that, and your implants aren't going to be anywhere near that. They may be 103 degrees in an extreme situation, but that's not going to make any difference to the implant itself. And so I think the error that was made with this is the belief that if your surroundings are 160, 180 degrees, that your body is going to be like that. But obviously that's not, because you know how you feel when your temperature is 101 degrees and how horrible you feel.
you're hot.
People that you're 105, you die, 106, whatever, you're on death's door. So that I think
That's
is a
great.
very simple debunking of that theory, which I'm shocked that when it was brought out there that people wouldn't just automatically say, but wait a minute here, that's not the case. It's not like if you're out in Alaska and it's 0 degrees outside that your body temperature is 0 degrees. Like, yeah, I guess if you're out there and you're frozen solid, then it wouldn't be, but then you're dead.
You're dead. Right. Yeah, I know. I mean, but that just kind of epitomizes, social media today in some areas. And that's why it's great to have people like you on there saying, hey, let's hold back. And because it is so amazing, my patients come in and they say, but I saw that on TikTok. Like it was like a Bible. I'm going, well, let me tell you what the reality is. Nobody wants to read anymore.
So you've been in practice, obviously, for a long time. You've got such a great reputation as probably the most well-regarded plastic surgeon in the country, especially with the cosmetic work that you're doing now. If a person is listening to this podcast or watching this podcast today, and they were to get some advice from you, they're thinking about having a plastic surgery procedure, whether it's a rhinoplasty or a facelift. What are some recommendations that you would give them so they can avoid getting botched and maybe getting a bad result out of it?
Yeah, I think it's really three things. I mean, it's experience, expertise, and looking for exceptional results. And how you get that is you first find a board certified plastic surgeon. Somebody that's certified by the American Board of Plastic Surgery. There's so many boards out there. People say they're board certified. So number two is, and are you operating in an accredited operating room, meaning that you're safe? And to be a member of our two big societies, they're the American Society of Plastic Surgeons and the ASPS and the American Society of Aesthetic Plastic Surgeons. You have to operate in an accredited facility. And that means you have an operating room that's accredited for safety, an anesthesiologist or a nurse anesthetist that's there. And you have to have hospital privileges. If you want to ask one thing is, do you have hospital privileges? Because if that person doesn't have hospital privileges, then that's a real big red flag. So it's accreditation, it's board certification, and then you talk to the surgeon, and are they in sync with what you want as your common goals? And then look at their media, look at their social media, look at their website, see if you like the results. Because everybody has a different flavor of a result that you like, whether it's noses, faces, or breasts. And if you like that, then that's a good potential choice. And then go see 2-3 people. There's we have almost 9 or 10,000 plastic surgeons in the United States today. And so most are very, very good. But I think the key is find an expert in what you want to do. And somebody that's likable, because I always tell people, there's 3 things I have for whether I'm going to do a patient's surgery is that they have to be reasonable, and I have to like them, and they can't smoke.
Those are good ones. Yes. What have you found to be the most fulfilling part of being a plastic surgeon, of your career in plastic surgery so far?
I think the most fulfilling thing in plastic surgery has been to watch my students and residents and fellows become leaders in plastic surgery. I've trained thousands of people, and I have 10 that are chairs in plastic surgery around the U.S. And to me, it's really giving back and teaching the next generation. I think that's really fun. It's kind of what we're obligated to do. And, we learned that. We were just talking about the University of Michigan, and that's what people like Dr. Jingman taught me, and Dr. Grab, and the folks I learned from at the Mass General. And, it's giving back that matters. And I think, to me, all the other stuff, and your family, that's all, I just recently wrote an editorial for the journal, and all these things in these plaques in the background, they don't mean anything. What it means something is you really have, there's only 5 people that make a difference in your world. And hopefully most of those are the people that are in your family or really close friends.
Well, on behalf of plastic surgeons around the country, I want to thank you for all you've done to help educate us. I know I've learned a lot from you, even though I've never actually been in the operating room with you. I've read a lot of your articles over the years, and that has taught me a lot. And I've always really, really appreciated your approach to plastic surgery, because it makes sense. That's probably the best way I can describe it, is whenever I learn about your approach, I know that whatever I read is going to make sense. And so I follow a lot of your recommendations. I want to thank you so much for joining me. This was a lot of fun.
Well, thank you so much, Tony. And you're welcome to come to my operating room anytime.
Maybe one of these days. So you can find Dr. Rohrich. He's a board-certified plastic surgeon in Dallas, Texas. We'll put a link to his website, drrohrich.com. He's very active on Instagram, so definitely follow him there. Also, he has a YouTube channel that's very, very educational, along with a YouTube podcast. So we'll put links to that as well on the caption of this video and this podcast. Thank you so much, Rod. This was great.
Well, thank you so much, Tony. You're a rock star. Thank you.
So my name is Dr. Anthony Youn. This is the Doctor Youn Show. Thank you so much for watching and listening. If you've been enjoying this podcast, if you could leave a rating or review on iTunes or Spotify, wherever you get your podcasts, it definitely helps me spread the word. And as always, I'll leave you with this: eat real food, use clean skincare, and auto-juvenate before you operate.